I'm Elizabeth. I'm one of the nurses at the IV Garden in Newton, Massachusetts, and I'm going to talk about how easy it is to do IM injections of micronutrients for yourself at home. These are all of your supplies. You've got your hand sanitizer, your syringes, your needle to draw up, and your needle to inject, which I will go over more as I am showing you. You're going to have your medication, alcohol swabs, and a sharps box. I am going to wear gloves because I am at the office, but at home you do not have to wear gloves. You just want to wash your hands with soap and water really well before you touch all of your medication and supplies. So today I am going to show you how to do 2 injections. We're going to do vitamin D in the gluteal muscle and some NAD in my shoulder. I'm going to get my vial of NAD. If it's your first time opening the vial, there will be a little metal cap that you're going to flip off, and then you'll expose this little rubber hub, and that is what you are going to clean with your alcohol swab. You want to clean the hub for about 5 seconds, give it a good scrub. And then you're going to open your syringe. You can just pop it through the back of the paper, pull it out. And then same thing, you're going to have a 21 gauge needle that you're going to use to draw up the medication. You can pop it through the back of the paper, take it out, and you're going to screw it into the top. And then you're going to remove the cap. And we will have told you what dose in milliliters. So I am going to give myself 1 milliliter or 100 milligrams. You're going to pull the plunger back to that 1 line and line it up right with the 1 line. Then you're going to pick up your NAD and invert the vial. You're going to insert the needle right into the center of that gray rubber stopper all the way in. And you're going to inject the air so that you don't create a vacuum and it's easier to continue to draw medication out. Sometimes it will start to fill on its own without me even pulling back, but you're gonna draw back. You wanna get rid of this bigger air bubble. Really tiny air bubbles are not going to hurt you, but what I'm gonna do is push back so that that air bubble is injected back into the vial. And then sometimes if you're getting air bubbles, you might notice that the tip of your needle is outside of the liquid, so you may want to pull back so that the tip of your needle is in the liquid and you're drawing liquid into your syringe. And then I am going to draw to the 1. I still see 1 little air bubble. You can flick it like that to get them to go up to the top, and then push that air bubble in, and then pull out straight up. There might be some drips, that's okay. And then what you're going to do is very carefully, you're going to draw back so that all of your liquid is in your syringe. You're not leaving any in this needle because you're going to change it. You're going to very carefully put your cap back on and twist it off because you're not going to inject with this needle. It's pretty big. You're going to put it in your sharps box. And then you're going to get your smaller needle that you were injecting with, a 25 gauge needle. Pop it through the back of the paper and attach that on there. And then you will push back so that you see a couple of drops coming up to the top of the needle, and then you know there's no more air there. Okay, so now I'm going to show you how to inject. There are a couple of sites that you can do. I'm going to start with showing you the deltoid injection with the NAD. And it's good to have a Band-Aid ready. The IM injections versus sub-Q, it's a little bit of a bigger needle, so there might be some bleeding, there might not be, but it's good to have a Band-Aid ready and have your alcohol swabs open. So what you're going to want to do is feel for the top of your humerus where it meets your clavicle, and then you're going to go about 2 fingers down, about 2 inches down. And then you're going to just clean the area, ever increasing concentric circles, nice big area. You can see where I've done my injections before. I still have a little bit of a bruise, that's okay. And then what I'm going to do is get my Band-Aid ready. This is how I like to do it. I like to take these little pieces off so I'm ready to put it on myself, and I like to stick it right here, and then take the cap off of the needle, and I relax my arm. A jelly arm makes it much less uncomfortable, and you're going to go straight in at a 90-degree angle. Faster is better. 1, 2, 3. I'm going to inject, hold for a moment, and then I'm going to pull straight out. See, there's a little blood. That's okay. Not a big deal. I'm just gonna hold for a sec. And I have my Band-Aid ready. I'm gonna wipe with one more alcohol swab here. It's already stopped. Put a little Band-Aid on. Okay, so now we're going to go to site number 2, which is my gluteal muscle. And I've got my gloves on, my Band-Aid ready, my alcohol swab ready, my injection ready. For those of you who might notice the color, this is a blue needle specifically for vitamin D. It's a little bit bigger because vitamin D is kind of a thicker liquid, and it just injects easier with a slightly bigger needle. Okay, so finding the right spot on your gluteal muscle is going to be tempting to go further into the meatier part of your gluteal muscle, but you actually have a lot of nerves and blood vessels there. So if we're drawing the gluteal muscle into sort of 4 quadrants, we want to stay in this upper outer quadrant for our injections to avoid those larger nerves and blood vessels. And there actually is quite a bit of muscle here, and over here is more fat, and we're trying to go into the muscle. So what we are going to do is find the top of our pelvis, our iliac crest here, and right at like the side of our body, we're going to come down from the top of our iliac crest about 2 inches, and then in about 2 inches. And we're going to clean the area, ever increasing concentric circles in a nice big area. I'm going to keep my alcohol swab ready in case there's some blood drops that I need to grab. I'm going to take this off. And again, I'm going to have a nice relaxed jelly muscle. I have all my weight on my opposite leg. My other leg is free, and this muscle is nice and relaxed. I'm going to go in at a 90-degree angle. And I'm going to inject. Hold for a second, and since I have 2 hands free, I'm going to have this ready in case there's a little blood drop. Pull straight out. There's a little drop of medicine. That is also fine if you see a little drop of the medicine sort of track back out of that injection site. And just wipe it with the alcohol pad and put your Band-Aid on. I'm going to take these off. And that is it. That's how you do your at-home IM injections. We are always here for questions. If you watch these videos and read the written information and you're still not totally sure what to do, we can always call you on the phone and chat with you. You can always come into our office in Newton for an in-person demonstration, and you can text and call us anytime. We are here for you. We want to help you. We don't want you sitting at home worried about how to do this. Thank you for watching.